My first cesarean section, going in for my fourth one, I was really scared. I will not lie. I was afraid because I don't know what I'm going to face. And most importantly, when I went to ask doctor how the cutting will be, the doctor told me that if they encounter problem below on my old incision site, that they will go on like this, they cut like this. So I was very much afraid going for the fourth one. What happened that I started betting on with a cesarean section with CS, surgery. Some people can walk into the hospital and say, I don't want vaginal birth, I want to do have a Caesar to have their baby, but it's a choice anyway. But sometimes there's always a reason for a woman to end up having a cesarean section. Like my own case, there's a reason for me ending up having a cesarean section. Yeah, I have 4 kids now. My first baby, when I was pregnant, I did lots of exercise preparing for the birth. Hello, my love. Preparing for the birth. But when I was 41 weeks on days, I wasn't in labor. I waited for 41 weeks plus. I didn't have labor. Naturally, labor didn't come. So I went I went to the hospital to be induced because I was already booked for induction. So I went. I was induced, and I entered labor, but labor was not dilating. It was not progressing. I wasn't dilating, and labor was not progressing. So I labored for excessively hours. Past 6 hours, I was in hot labor, but I was not progressing. So the doctor said my baby's heartbeat is dropping, and I need to be taken to the theater for surgery immediately. So that was how I ended up having my first cesarean section. Then my second baby. When I got pregnant for my second baby, I was hoping that I will, I was preparing to have my first vaginal birth. So I want to have that experience, and, I was highly getting ready for it, preparing myself. Then when we got to 36 weeks, I went to the hospital for my antenatal care. When I got to the hospital, doctor checked me and said they are taking me to the theater right away to have my baby. I was like, what happened? Doctor said it's oligohydramnios, so the fluid was small for the baby in my womb. They need to bring the baby out before she faces danger. So I was taken to the theater, and then I had my second cesarean section, and then I got pregnant for the third one. You already have, as a person that already had 2 cesarean sections, I wouldn't want to put my life on the line. I'm already a high-risk patient, so I don't want to put my life on the line. A high risk, so I don't want to try. Then I walked to the hospital, and then I booked for elective Caesar. I booked myself a day for delivery. They gave me dates, and then I went on that. You know how you bend? You bend your head, you sit flat, you sit straight, bend your head, and then you get the medicine on your back. That's the beginning of your delivery. Once you get the medicine, everything will start progressing. Under 40 minutes, you are done. So I got the medicine, and then the delivery started going progressively. One thing that was different from my fourth cesarean section to others was that I vomited all through the delivery. They were giving me injections, and I was vomiting. I don't know, the injection that they were giving me in the theater was triggering the vomiting. So I was being given the injection, and I was, vomiting. Besides that, every other thing went successfully, went well. I had my baby, and this is my baby here with me. I had my baby. Now let's talk about walking, standing up after delivery. Standing up after having a cesarean section is, it's just between you and your God, because, going to that bathroom, I forgot something. Let's talk about catheter. Putting catheter is a very uncomfortable something. Very uncomfortable. Like when they will put it on you and when they will remove it. Yeah, it's really, really quite uncomfortable corner for every delivery cesarean mom. Yeah. So catheter is, whenever I see it, my mind always skips. I'll just tell myself, I'm having something to help myself. So when the nurses placed it on me, I was just doing breathing. They just put it. When they want to remove it, I was also doing, they just pull it out. Even when they pulled it out, I was still feeling very uncomfortable. Having your first pee when catheter was removed after your surgery, after your cesarean section. I don't know why people are not talking much about that. If you are having your first pee after removing your catheter after surgery, it's always a shock. Electric shocks. Yeah, that is how you'll be feeling. How electric shocks? You just feel it when the pee is about to come out. You just feel it. Pee. Don't mind me. I was just trying to explain how I felt. So you're just feeling the shock, like it will be coming like a pressure, a pressure from somewhere. So sorry that I'm laughing. So that was how I felt, and then you take care of yourself in the hospital. After that, taking care of your incision site, taking care of your baby at the same time. Then looking forward to being discharged. About the incision site. My first cesarean section, I was cut the same place I was cut in my other pregnancy. I was cut the same place, and then let me just appreciate my last surgeon, the doctors that attended to me through this my last pregnancy. In fact, from my beginning to my end, they are all good. This is my fourth cesarean section. If you see my incision site, you just kiss it. Very clean. They did a great job. Very clean job at that. I love looking at it. How do I even take care of my incisions? I use this. This is a surgical spirit. There's one I use in the hospital. The hospital gave me that one, so I got this. I use it because you need to be keeping your incision sites clean and dry all the time. So I use this for myself, and it's very good for keeping yourself dry after having a cesarean section. So it's very good to me, and this is what I use. Now, how do I handle the pain of, there is always pain after the epidural wears off. Yeah, the pain always come. I was given injections, the pains relief injections in the hospital. Hello, my love. I was given pains relief injection in the hospital. Hello, my baby. Hello, my baby. I'm a baby girl. So I was given pain relief medicine, and then when I was discharged, I got this. I got this medicine. This is suppository. We call it suppository. The medicine you insert in your anus. You insert it in your anus. It's many one. This is sorry, my love. This medicine is a lifesaver. You see how small but mighty. You insert it in your anus. It saves a lot. It saves a lot. Like, it will make you will not feel pains. You will not feel pains. In fact, you will have yourself back so quick after having a cesarean section. So this is the one I'm using. My husband always buys this for me. So this is the one I'm using. It saves me a lot. Like, if I'm talking, you will even be asking me, are you sure you had a baby? Are you sure you are the one that had a cesarean section? You understand what I'm saying? So this is a lifesaver for me. Time I'm going to have a cesarean section, I always pray to my God Almighty to please take cough, take catarrh, take sneezing away from me. But you can't run away from it. Like, like if I want to talk to you now, I will just tell you that I survived the cough. I survived sneezing after cesarean section. Yeah, it's a bragging right because I survived it. Having cough, sudden cough, sudden cough. It will just come. You know how the cough used to come? It will just come to you, boom, and you cough. Bah. Once you cough it will just come to your incision site. That is where you will feel the pain. You will not feel the pain in your throat. You will not even feel it in your head. You will just feel it down in your incision site. If you sneeze, what about laughing? I used to avoid laughing with everything in me. No matter how funny your jokes is, I can never laugh in it. And then how do I handle most of it? Like, if I notice that I'm about to cough, I will use all my strength and a pillow or anything close to me that is closed. If there's nothing close to me, I will use my hand and press my tummy. I will hold it and then do the coughing, do the sneezing, do the laughing. If there is pillow, hello my love. If there is pillow, I will just take a pillow and press on my tummy and then do the coughing, do the sneezing, do the laughing. But it won't be too much. It's just a slight of it. Yeah.